Insights from the world's best medical minds. You are watching therightdoctors.com.
Hello and a very good afternoon to all our viewers. This is Dr. Sujata Kar. I am an obstetrician and gynecologist practicing in Bhubaneswar for the last 3 decades almost. I practice obstetrics and also laparoscopic surgeries and also IVF. Our center, which is Kar Clinic and IVF Center and Hospital, is known as the first IVF center of the entire Eastern Orissa. Today I am going to talk about menstrual hygiene and how these things are very important for young girls. In fact, everybody to know and understand. A couple of years back, some of us gynecologists had sat down and we had pledged to take part in adolescent health education. And therefore, we had formulated a small group, which was Sukanya Health Education Program. And through that program or that agenda, couple of us gynecologists were going around all schools and colleges of Orissa. Important education. So that was our agenda, and it was a great initiative that we had taken. Started off in 2018-19, and then because of the COVID year, we had to lie low a bit. And I hope again in 2012 we will be actively going around and doing adolescent health education. So now let me share my screen with you all for my presentation today. So my topic is adolescent health and education. And this was the program I was talking to you about. What I'm going to cover today is what is menstruation, the physiology, what is menstrual hygiene, some of the questions that girls face in school as they are growing up, mostly body image issues, nutrition, food habits, what are the risks of obesity, what are the problems with obesity. Girls have many questions about breasts also, we're going to talk about that. And some of the questions about trials and tribulations of adolescent, sexuality, risks of pregnancy, and sexually transmitted disease. Now, first, what is adolescence? The modern meaning of adolescence is basically teenage. It lasts from the age 12 to 18 years. And basically, in simple language, it is the transition phase between a childhood to a mature adulthood. Point is, why is this phase very important, and why do we want to educate girls about this phase and how they grow up to become adults? As most of us know, there are many changes that happen in adolescent that help girls to become young women, adults. Internal changes are the girl's ovaries and the reproductive system start to develop, and therefore the menstrual cycle begins. Externally, the breasts start to develop, pubic hair, etc. develop, hips widen up, and the monthly period starts. In adolescence, various physical, mental, and emotional changes occur. Menstrual cycle is only a part of it. It is just external evidence that the body has become ready for maturehood. And in fact, it prepares a woman to carry a pregnancy. Now the menstrual cycle, these are the various reproductive organs, like you all may be knowing, the uterus, the cervix, the vagina. These are the fallopian tubes, and this is the ovary. The ovary carries the eggs, the uterus carries the pregnancy, and it is the vagina through which the external passage through which even the menstrual blood is lost externally, and the seminal fluid can enter for pregnancy to occur. The menstrual cycle is basically 3 parts grossly. One is the follicular phase, one is the ovulatory period, and then is the secretory period, and fourth is the menstrual period. So during menses, there is bleeding, and during the follicular phase, one egg in either of the one ovaries grows, and in the ovulation phase, that egg gets released. And if at the time of egg being released, which is typically between 12th to 18th or in a girl who has very regular cycle of about 1 month, during that time, if a sperm fertilizes the egg, then that can result in a pregnancy. What I just told you in a pictorial depiction, during the ovulatory phase, egg is released or ovum is released. It is the fallopian tubes which pick up the egg. And if at this time there is the sperms enter the reproductive canal, then there can be a pregnancy. And if that cannot happen, if although the egg is ready for fertilization, if that does not happen, the endometrium or the lining of the uterus, which has developed to receive the pregnancy, that sheds itself, and that shows as a form of, and in the form of menstruation. Now, when girls start menstruating, it's a very life-changing event for them, and they have a lot of correct, wrong information that they get from their peers, from their parents, from home, from others, and people and girls carry lot also. And there are so many with menstruation. The major problem being that it is considered as an unhygienic duration of a woman's in a month in a woman's body, and therefore girls ask questions like why we cannot enter the temple, why we cannot touch the food, why we cannot do this, why we cannot do that. They ask if what happens if I don't get period. They don't want to get period, and whether they should use a sanitary pad or they should use a cloth. Their question is why boys cannot get pregnant, and etc. etc. There are many myths and wrong ideas that people have. There are some questions about pregnancy, about menstrual cycle, which we like to clarify when we are talking to girls in schools about adolescent health. One is the painful menstrual cramps. They have to understand that nearly 2/3 of the adolescents face painful menses. Premenstrual symptoms typically occur in the second half of the menstrual cycle, which many girls face. Typically, fullness of breasts, breast pain, bloating of the abdomen, fatigue, headache. Some people feel headache. Some people feel diarrhea and constipation. Some girls feel changes in appetite, irritability, mood swings, tearfulness, difficulty in concentration. So some girls really feel premenstrual symptoms. Many don't, but some of them do. Most of the times, just reassurance and some painkiller during the cycle is enough. There are a couple of questions which in simple answers. The initiation of menstruation is called menarche. The age of the normal menarche may vary from 12 to 16, although we know that although all over the world it has come down. So anytime from 10 plus or 11 plus is now considered normal, but it is certainly abnormal not to get periods till 15 years, during in which one should show the doctor, and 16 is the absolute upper limit. Some varieties of menstrual dysfunction occur in about half of the adolescent girls. So initially, once you get your period, if for the first 2-3 years, if the menses are very irregular, either they don't come or they come often or they are different in flow, it may not be a very big issue. Length of the menstrual cycle can vary from 21 to 35 days, and cycles usually after 2 to 3 years tend to become normal. What is abnormal menses? If they don't get any menses after initiating for a couple of months, delayed menses anything more than 35 days, short cycles less than 21 days, excessive menses is when they get heavy bleeding, anything more than which lasts more than 5 to 7 days, anything in which a per day menstrual pad required will be more than 5-6, any bleeding in which there are clots, intermenstrual bleeding to bleed in between menses. All these things are abnormal and doctors should be consulted. Now, why the importance of understanding menstrual hygiene. They have to understand what is menses, what happens, what are the common problems. But what is the importance of we know that there is a difference health as the state of complete physical, mental, and spiritual well-being. In the same language, reproductive health is defined as a state of complete physical, mental, and social well-being, not merely the absence of disease and infirmity in all matters relating to reproductive system, and its processes and functions in all the stages of life. So there are many determinants of health. We know that income, social status, social support networks, employment conditions, working conditions, education level, social environment, physical environment, what kind of house they live in, personal health practices, the healthy child development habits, and of course, biology and genetic endowment, cultural ethnicity decide how well a woman's or a girl's reproductive health will be maintained. But women should have reproductive, they have reproductive rights, which, if you look at it, is a very a big list. They should have the right to decide when to marry, when, how many children to have. They should have the right to know. They should have unrestricted access to information, unrestricted access to. So sorry for the interruption. So I was talking about reproductive rights of women. Women should have the right to decide about marriage, whom to marry, to get a responsible and empowered husband, to decide on the number of children, to have access to health, safe health practices. They should have access to family planning methods. They should have access to safe pregnancy and childbirth. They should have a right to be free from sexual violence and assault. So there is a long list, and we in India and many places in the world are far from being able to achieve. But it is certainly our rights. It is within the rights of women that they should be able to get this. The women are in India, especially, face lot of disparities, health disparities, reproductive health disparities, because of gender discrimination, domestic violence, level of education, malnutrition, which is then associated with anemia, osteoporosis, reproductive health problems like poor sanitary, poor housing, childbirth, abortion, contraception, etc. So this is a problem for women in India because of the socioeconomic status. But apart from that, also, women and women's body is definitely more vulnerable to many of the health aspects, like I will be showing you, because of menstruation, because of a normal and abnormal vaginal discharge, because of pregnancy and its related period that changes that the body goes through, and because of the fact that women have a very short and a different anatomy of the urinary tract. Women are very prone to infections and reproductive health issues, which is very unique to them. And during our education, we try to make girls understand about the anatomy of the external genitalia, and how the position of the urinary opening, the position of the vaginal opening, and how it should be cleaned, and how a menstrual hygiene should be maintained, from where the urination comes out, and why unhygienic practices can lead to urinary tract infection. And similarly, unhygienic habits can lead to reproductive infections. So understanding anatomy and understanding the paths involved makes them understand how they should maintain hygiene. Apart from the fact that socioeconomic problems of Indian women, we also have the big problem of open defecation in Indian rural areas, which even in some urban situations, where it is a very big problem to women, at least, to be able to maintain reproductive hygiene. Other than that, this was when we were taking classes for girls, we used to ask them, Are they aware the urban girls who are reading in good schools, are getting a good education? Are they aware what percentage of women use sanitary pads in India? It's very, very less, according to a Times of India publication. Hardly 70%, 30% women in India probably use sanitary napkins, in spite of the fact that big incentives are being given by government as well as private agencies. So there are lots of hurdles to be crossed where menstrual hygiene is concerned. Now, vaginal discharge is another thing for which girls get very worried, mostly also because their mothers tend to make them not understand what it means. We try to explain to them that vaginal discharge means the fluid or the mucus that comes out of the vagina. It is caused by changing levels of hormones, and largely vaginal discharge will be normal. It is a normal discharge. It can be different in different parts of the different times of the menstrual cycle. Earlier in the cycle, it can be thin and flowy types. Mid cycle, it can be a little more thicker, and towards the end of the cycle, it becomes very thick and more mucus in nature. What they need to understand is that any vaginal discharge which is associated with pain, itching, redness, or if it is thick, white, and curd type, if there is pain while urination, and if there are any patchy eruptions in the external genital areas, or if there is blood stained discharge, or if there is foul smelling discharge. This is the kind of vaginal discharge for which they need to consult a doctor. Some good habits: wear cotton underwear, loose fitting pants, underpants and skirts. Do not overwash the area. Treat skin in the genital area very gently. Do not use a feminine hygiene product overtly, and perfumed soaps and creams should not be used overtly. There is no need for internal cleaning, douches, vaginal douches. One should evacuate the bladder reasonably frequently, and there is no need to keep washing external genital areas after every time of passing urination. Soft, white, unscented toilet paper can be used while menstruating. 100% cotton menstrual pad should be used, and frequently changing pads is of most important, every at least 3 to 4 hours. Then there are many body image issues that girls have, during adolescent. While growing up, they compare their bodies with their peers, with others. Why that one is looks like this? Why I look like that? Why I'm thin? Why I'm fat? About the sizes of the breast development. Many girls have many anxieties. We try to explain to them that it is each to their own. How their body is formed is not decided by them. It is decided largely by genetics. A minor asymmetry in the breast is very normal, and it can vary greatly. Any abnormal pain or swelling which radiates to the axilla, arms, and which is not cyclical. In that situation, only doctor may be consulted. Otherwise, breast tenderness, breast pain, which is cyclical, is very, very normal. Then the last part of my talk is related to nutrition. Girls need to understand that good nutrition is what is needed to be healthy in body and mind, and you are what you eat ultimately. So a well balanced diet is of utmost importance, and this is the typical food pyramid that we have read in our schools, in our biology and other books. The fact that how much should be the carbohydrates, fruits and vegetables, meats and alternatives, and the least amount should be fats and oils, and almost zero should be the sugars, refined sugars, and refined carbohydrates. We tell them that what tastes good is not necessarily healthy. You have to understand that a lot of them, the fast foods, have a lot of empty calories. They just taste good. That's all. Young girls need to understand the importance of natural things, like natural Indian things like we used to have earlier, like lassi, like tender coconut water, like nimbu pani, rather than settling for the aerated drinks that is so popular these days. They need to understand the importance of green leafy vegetables, Because of the menstruation, a bad eating habit can lead to chronic anemia. And as you know, many of the young girls and young women in our country, those who are getting pregnant, that means they are young adults, they are also anemic. That is because of the chronic undernutrition and eating bad kind of food. So a well-balanced diet is very, very important. They should eliminate trans fatty acids and saturated fat and consume more unsaturated fatty acid. Simple sugars should be limited. High amount of vegetable, fruits, nuts, legumes, and whole grains should be included. Iodized salt, and one should limit the consumption of sodium. Essential amino acids and protein should be important for us, and they should drink a lot of water. Bad nutrition can lead to obesity, anemia, other nutrition deficiencies, and infections. But like we said, we face a lot of problem of undernutrition and malnutrition in our country for sure. But we also know that obesity is becoming a very big problem in our country, because the Indian middle class or the Indian lower middle class is one of the largest in the world, and they have access to all unhealthy, cheap food, which has led to a pandemic, no, sorry, an epidemic of sort of obesity, and ultimately obesity, which has led to many metabolic and reproductive issues like polycystic ovarian syndrome, endometriosis, etc. And now polycystic ovarian syndrome, which has become such an epidemic in our country that it is thought that maybe 30 to 40% of girls in schools probably have PCOS. The last part of being healthy is about physical exercise. This again is very important because our children are fed an overdose of movies, movie stars, Bollywood dances, Bollywood songs, and they have not just learned to make physical activity a part of their life. So the earlier in the stage we teach them, the earlier in adolescence that we teach them, likely they will inculcate physical activity as their, a part of their living throughout their life. So we tell them that in every day there are 1440 minutes, at least 30 minutes. In adolescent, it should be 1 hour, but at least 30 minutes they must include, they must keep that time for physical activity, because that not only helps maintain health and weight, it relieves stress, anxiety, depression, it improves their quality of sleep. We know that sleep is another major issue for all the young people these days. So understanding fitness is important. How to get fit is another aspect. It is another big lecture that one needs to give some time and understand it. So to conclude, the attitude to period has to be rebranded to positive. Everybody in Indian households, whether lower socioeconomic or poor or middle class or upper class, they need to rebrand and learn to talk about menstrual hygiene and women's health issues. It has to be positive. They have to take steps to protect fertility, be vigilant about sexually transmitted diseases and pelvic inflammatory diseases. Smoking should be, very strictly made to understand that is most harmful practice. They should be aware of environmental toxicity and food, maintain healthy weight, do not compare with others in your peer group, and should not be despaired based on social media postings, and they should look after their mental health largely. So thank you very much for this lecture. I have some questions which has been, posted by people. I'll read them out and try to answer as many as I can. So the first question that I have is, why do girls menstruate? So it is a physiological thing, just like human beings or all living beings have to eat. have to urinate, have to clear their bowels. Similarly, menstruation is a part of reproductive physiology, and because the burden of reproduction is on women, so girls menstruate. The second question is, what are some of the myths associated with menses? Like I told in my presentation, there are many myths. The commonest being that during menses, the individual is impure. And that is why they cannot touch food, they cannot serve people, they cannot touch gods, which is very wrong. And of course, menstrual myths are also different in different cultures, different religions. So I'm sure other cultures and other religions have different myths, but many in the Hindu family have such notions where the girls do not go out of the house. In extreme situations, they are asked to stay put in a room. They are not allowed to eat some things, which are considered hot, like non-veg, etc. So there are many myths that are associated. The third question is, what is ovulation? Ovulation is the stage of menstrual cycle during which one egg is released from the ovary. And that is the phase during which a woman is likely to get pregnant. So the purpose is that. Fourth question is, why are women prone to urinary infections and vaginal infections? Like I said, the urinary tract, the urethra, the distal urinary tract, which is the urethra, is very short for women. And therefore, it opens to the external area, which is very close to the vagina. So having infection in the vaginal area or having injury in the around the urethra can lead to quickly ascending infection into the urinary bladder, and also can ascend into the ureters and kidney. Therefore, they're highly prone. The vagina is also an open passage which has direct link to the intra-abdominal cavity, which is open to the cervix and uterus, and therefore, and especially during the time of menstruation, sometimes during menstrual cycle, during pregnancy, the immunity is low. The immune cells or the local immune cells in the vagina are low during these times in a menstrual cycle and during pregnancy, and therefore they are more prone to infections. The next question is, what is normal vaginal discharge? So some vaginal discharge is very normal, which is cyclical. To have a thin vaginal discharge in the early time and to have a thick vaginal discharge towards the mid-cycle and towards premenstrual time is a very normal discharge. Anything associated with itching, redness, foul smell, blood staining is abnormal. Next, what are sexually transmitted disease? Basically, any disease or any infection can happen to an individual as a result of sexual intercourse is called a sexually transmitted disease. The typical examples are gonorrhea, HIV, AIDS, hepatitis B, etc. There are many. I'm just giving you a few examples. Next, what are the long-term impacts of infection? Unfortunately, in female reproductive tract, because the female reproductive tract has very fine organs like the fallopian tubes, which have very fine functions like transport of eggs and fallopian and sperms and the embryos. So damage and long-term infertility, that means difficulty in becoming pregnant, are some of the long-term impacts. The next question, is it normal to get menses once in 2 months? Well, to get once in 60 days is not normal. It needs to be investigated. Next question is, what are the advantages of administering human papillomavirus vaccines to adolescents? So now it has become a normal part of vaccination for all young girls to receive human papilloma vaccine virus, which is called, common lay term is cervical cancer vaccine, in adolescence starts at the age of 9 years and can be given up to the age of 43 years. The advantages that it prevents, primarily prevents cervical cancer, also prevents other non-cancerous HPV virus related diseases like herpes simplex, condylomatas, various genital warts, anal warts, etc. Next, why is it that children starting human papillomavirus vaccine below the age of 15 require only 2, whereas adults require 3? Okay, so now the cervical cancer or HPV vaccine is given as to adults in 3 doses, which is 0, 1, and 6. At 0 time, and then after 1 month and 6 months. Anyone who is less than 18 years, only 2 doses are required, which is 0 and 6 months. The reason being that the younger people, the younger you are, the more responsive your immune system is. It has better immune reaction, immune output, as well as the memory cells tend to be better. So young adolescents receiving HPV virus, for them 2 is good enough to get the kind of antibody response that is good enough. Next question, which cancers other than cervical cancer does the human papillomavirus vaccine provide protection? So human papillomavirus, the vaccine, other than cervical cancer, also gives protection in women against vulval cancers, vaginal cancers, anal cancers, and also some head and neck cancers, and some few more also. Also, the next question was, what are the common reproductive tract infections caused by unhygienic menstrual practices? The commonest infections are condyloma, chlamydia, gonorrhea, and many gram positive and gram negative, as well as anaerobic infections. What are the effects of switching from sanitary napkins to organic cloth pads for adolescent girls? So I'm not sure what this question means, but organic cloth pads, as long as they are disposable or if they are properly clean and they are fully cotton, they might be slightly better than commercially available sanitary napkins if they are not fully cotton. So cotton organic cloth, very hygienic, is also fine. How does the use of sanitary pads influence hormone function? I'm not sure what this question means, but I am not aware of sanitary pads influencing hormonal functions. Next question, is there an ideal age for menarche? There is no ideal age, but usually it can start anytime after 10 years, after 15 years. Next question, what is the significance of white discharge observed before menarche? Is there a time interval between the first appearance of this discharge and first period? Generally, to start having some kind of a discharge might mean that estrogenic hormonal activity has started in the body, and therefore some kind of a watery minimal discharge is there. There is no well-defined period that we can say that now within next couple of months she is going to get a period. I don't think there is any specified interval between discharge, starting to get first discharge and the first period. The next question, what kinds of vaginal discharge are associated with different reproductive tract infections? So any discharge, like I said, is foul smelling, which is, or it is thick and curdy, white, or which is yellowish, which is greenish, which is blood stained and typically foul smelling. These are the different kinds of discharges which may be associated with reproductive tract infections. Next question, is there an age limit to start using menstrual cup? There is no age limit, but the person who's using the menstrual cup has to understand how to use it, how to clean it, how to dry it, and then use it again. So I'm guessing that older adults would be better candidates to understand their own body. Next question is, what is the incidence of toxic toxin shock syndrome as a result of use of menstrual cups and tampons? Now, although this is very rare, toxic shock syndrome, but it is a very serious condition and can lead to death also, septicemia and death. So although the incidence may be very small, but everybody who is using a tampon or a menstrual cup needs to be aware of it and therefore take adequate care. The next question, what are the health risks associated with wearing a menstrual cup for longer than 12 hours? Health risks primarily are infections, overflow, leakage, and also chances of toxic shock syndrome, like it was mentioned earlier. Next question, is there a prescribed diet that you would recommend during menstruation? During menstruation, a healthy diet at every time is what is required, but during menstruation, diet that boosts your immunity, which is full of, lactobacilli like curds, like nuts, green leafy vegetables, which is full of iron, which will give us iron for the blood that has been lost. These would be rather recommended. Next question, what are the common causes of vaginal bleeding and spotting in between periods? Now, getting menses bleeding in between periods is a serious situation and a doctor should be consulted. One of the commonest and not very dangerous situation may be when girls or women are taking the oral contraceptive pill or any other kind of pill and that is not taken properly and regularly. That can lead to intermenstrual spotting. But other than that, there are many pathological situations where this can happen. And so it should be dealt with utmost care. The next question is, what are the different types of amenorrhea? Amenorrhea, well, if this is a, professional question, it would mean primary amenorrhea and secondary amenorrhea. Primary would be when a girl has never ever got her period, and secondary would be any person who gets menses and now has stopped getting menses is called amenorrhea. Next question is, what are the certain medications like antipsychotics, anti-allergies can lead to amenorrhea? Yes, that is true that antipsychotics can cause irregularities in cycle. And when that happens, they need to consult their doctor as to how to manage that. Next is, what are the complications of amenorrhea? Now, there are many complications. Of course, the first one would be one needs to exclude pregnancy. But I would think that the commonest problems these days, if it is hormonal related, it would be related to a serious hormonal condition called polycystic ovarian syndrome. So there are many, many causes of amenorrhea. These are the two commonest that I told you about. And therefore, it needs proper consultation at the proper time. What is the impact of substance abuse on menstrual health? Substance abuse can result in multiple health problems. Menstrual health, usually they, I think, lose a lot of weight, etc., and therefore can lead to menstrual cycle irregularities also. Not getting menses for a pretty long time, etc., can happen. What is the incidence of eating disorder in adolescent males? I am actually not very well aware of the incidence of eating disorders in adolescent males because eating disorder is very common in females. And these days it's becoming very, very common. And finally, are there any scientifically proven restrictions that menstruating adolescents should be mindful of? I'm not aware of because during menstruation, scientifically, the girls should be able to do all their regular activities, which means playing other than short of, swimming, etc. Almost all physical, mental, and other activities that they are capable of, they should be certainly doing. So I think this is the end of the questions that I have with me. Thank you very much. I will stop sharing my screen now.
Insights from the world's best medical minds. You are watching therightdoctors.com.